So I am really grateful for everyone who's come out today. It was good to feel the good energy here, but we all know the storm that is approaching all of the United States of America. Last week, as we'll hear from the Congresswoman, the congressional Republicans decided to push forward a budget that was very clear what it would do, very clear the threats to Americans. In order to try to make room for trillions of dollars worth of tax cuts for the wealthiest Americans, they targeted vital programs for Americans. In other words, they said that we're going to pay for these tax cuts for the wealthiest, cutting the kind of programs that everyday Americans rely on. And so we're here today to make clear to congressional Republicans, make clear to President Trump, make clear to Elon Musk, that you are coming after bread and butter, everyday Americans. You are threatening health care in America, all so you could give bigger tax cuts to people like Elon Musk. It is Republicans who are successfully lobbying on behalf of the highest income earners to have a focus on essential programs. We in New Jersey know the value of food assistance, tuition support. We in New Jersey know the value of health care for our elderly, our seniors, and our disabled. We know that when you threaten programs like Medicaid and CHIP, that you threaten actually the well-being of all of New Jersey. I think it's really important for us to understand what this is about. It is about putting even a bigger hole in our federal deficit, giving trillions of dollars to the wealthiest people and corporations, all by denying everyday Americans the basic essential services, from health care to food assistance to services for our seniors and disabled. This is the height of cruelty. It is the height of misunderstanding what fiscal responsibility is all about. This will be punishing to our economic well-being. It will create larger deficits, and ultimately, it will hurt Americans. But today, we want to zero in on Medicaid. It's a program that overwhelmingly, upwards of 80% of American people have a positive understanding about because it touches most Americans' lives. I'm not talking about some abstract government program. I'm talking about New Jerseyans' access to their primary care providers, their oncologists, their nursing homes, their home care workers, their pediatricians, their OBGYNs. Medicaid isn't a small government program that goes unused. Nearly 2 million people here in New Jersey rely on Medicaid. 2 million New Jerseyans. And truly, it touches everyone in our state. And yet, because of what Donald Trump, Elon Musk, and congressional Republicans are doing, Medicaid is slated to see cuts of up to $5.2 billion. Those kind of cuts would devastate our state and put even more pressure on every New Jersey taxpayer. Republicans are set on demolishing Medicaid. And again, why? Because they want to take health care away from everyday Americans in order to give tax cuts to the wealthiest people in our country and create even more budget deficits in the process. They're seeking to implement something they call work requirements, that to many people might sound good. But here is folks that talk about cutting more bureaucracy, and just by creating work requirements, they create more bureaucracy within Medicaid that drains more money away from patients. More than that, every Congressional Budget Office study on so-called work requirements show that it doesn't increase workforce participation, it actually lowers the rates of coverage in their states. We know that such so-called work requirements would mean that about 700,000 New Jerseyans could lose coverage. 90% of Medicaid beneficiaries are employed, working, or if they're not, have circumstances that prevent them from working. Nationally, these so-called work requirements could put 36 million Medicaid beneficiaries at risk of losing their coverage. This is a cynical way of throwing more people off of coverage and putting more economic burden on Medicaid programs in state after state. What we are talking about here is not a program. We're talking about here is devastating the lives of tens of millions of Americans and of millions of New Jerseyans. This is a catastrophic crisis that we must stop. Across the country, 1 in 5 Americans, 1 in 5, rely on Medicaid. The vast majority of beneficiaries are our older adults, the elders we were all taught to respect. People who are also living with disabilities rely on Medicaid. And our children, America's future. For them, Medicaid is a lifeline. More than 1 in 3 people with disabilities have Medicaid. And over 30% of New Jersey births, close to a third of the children born in the state of New Jersey, are covered by Medicaid. Medicaid covers literally almost half of the births in the entire nation. And of course, our seniors. I came up in Newark visiting so many of our seniors here, and I realized then how much of Medicaid is driven by our senior citizens and giving them dignity in their elderly years. They account for 34%, more than a third, of Medicaid spending. In fact, Medicaid pays for services for 2 in 3 nursing home residents and pays for home-based services for close to 2 million seniors. Children, older adults, and people with disabilities dependent on home care, and low and moderate income adults who don't have employer-based health insurance are now at risk of being stripped of the care and services that guarantee their health and well-being. And now let's not forget why we chose where we are right now. New Jersey hospitals. This is a devastating blow, should it happen, to the New Jersey hospitals that we all rely on. Hospitals are expected to see a savage cut in funding. In fact, right here at University Hospital, they are facing the possibility of seeing more than $149 million in cuts. This is a hospital that takes care of our most vulnerable, our most needy. This is a hospital which is called a Level 1 trauma center. It's our only Level 1 trauma center in the entire state. We must ensure that hospitals like this in our state have the tools and resources necessary to take care of our citizens. Now, tomorrow's going to be quite a day. I'll be right there in the front as Donald Trump comes forward to give his joint address to Congress. And he's going to use a lot of rhetoric, like I'm going to actually lower costs for New Jerseyans. Well, that's a lie. He has done nothing to lower costs for us. We in New Jersey have seen our costs for groceries, for housing, and other essentials go up. He's going to say that Doge and Elon Musk are making cuts to our government. Well, what he's doing in New Jersey is laying off our veterans, laying off critical services, and hurting people in our state. And then he's outrageously going to talk about the one big, beautiful bill that he's trying to push through Congress. Well, this is the one big, beautiful bill that's quite ugly and targeting millions of New Jerseyans, targeting every New Jersey taxpayer. Remember, his last big, beautiful bill took away New Jersey's state and local tax program and created even more, trillions of dollars more in deficits. And what we're seeing in our communities really in any way does not match to the promises he made during his campaign or the promises he's making now. New Jerseyans across our state, independents, Republicans, and Democrats, are worried by his erratic behavior, his coziness to Elon Musk. They're frustrated that his actions are leading to not lower prices, but higher uncertainty and fear and worry that just like the last big tax bill he did, New Jerseyans will bear the brunt. Prices continue to rise. The administration's actions keep putting the lives of New Jerseyans in harm's way. And you don't have to take my word for it. With this morning, we have service providers who work with Medicaid recipients and everyday New Jerseyans who rely on Medicaid for critical care. Medicaid is not a program, it is a lifeline. Tens of millions of Americans rely on it. It's a program that benefits Americans in small rural towns the same way it benefits Americans in cities like this one that we're in. And my call to my colleagues in the United States Senate on both sides of the aisle is to defend Medicaid, to stop Donald Trump from destroying the lives of millions of Americans in order to give the wealthiest Americans bigger tax cuts. Senate Republicans are now tasked with reconciling a budget resolution that does undue harm to their constituents. This will be a true test for where they stand. Do they stand with Americans or do they stand just with the wealthiest? But let me tell you why even that is not the right way to say it. You see, we have interwoven destinies in this country. It's not us versus them, it's just us. If you give a few more dollars to folks who don't need it and take away from the millions who do, what you end up creating is a country that turns its backs on its underlying values and virtues. We value our seniors. We value our children. We value the disabled because they're part of our community and our country. I am disheartened that this bill has already moved in its first step through Congress. It is staggering what it would mean to the state of New Jersey and states all over our country. We are at a crossroads in America. Will we go down this cold, cruel path, or will we stop it from happening and continue to stand up for every American and truly be the country we say we are, a nation of justice?